So I actually had that approach as well of maybe there's some natural things you can try for a certain ailment. And then if that doesn't work, we could always try a medication later. But it wasn't reach for the pharmaceutical. And if that doesn't work, try something more natural. It was, let's try something natural. If you think it's going to work well, then we'll go to something pharmaceutical if it doesn't. So that was always sort of my thought process.
Wow. Why doesn't that happen on a regular basis when I go to a doctor appointment?
Like a conventional medical doctor. I think it's training. As I went through medical school, my mom hit on it one time. She said, you're having to flip your brain in a way as to learn everything you need to for medical school, because it's not the same way of thinking. It's very disease-driven, symptom-driven. It's not as much about how that disease is affecting that patient. And I think it's a subtle difference, but it's a big difference if we think about, are we treating a disease or are we treating a patient who has a disease? And so when we look at it from a patient-centric approach like that, I think it totally changes our paradigm.